Dear brothers, dear sisters, welcome. The day when we started with our videos finally came, and since it's our first video, I would like to talk about basic stuff. So, what is a bleeding disorder? A bleeding disorder is basically a problem with coagulation of blood, and patients with a bleeding disorder, they bleed longer, and they can also die because of that. The most known bleeding disorders are hemophilia A, which is factor A deficiency, hemophilia B, which is factor 9 deficiency, and von Willebrand disease. I mentioned factor. Factor is a protein that is produced by our liver and is an essential part of coagulation. So if factor is missing, the coagulation doesn't happen.
To better illustrate the role of factors in the coagulation process, let's look at this diagram. In the body of a person without hemophilia, when a blood vessel is injured, the walls of the blood vessel contract to limit the flow of blood to the damaged area. Then, small blood cells, called platelets, stick to the site of injury and spread along the surface of the blood vessel to stop the bleeding. At the same time, chemical signals are released from small sacs inside the platelets that attract other cells to the area and make them clump together to form what is called a platelet plug. On the surface of those activated platelets, many different clotting factors work together in a series of complex chemical reactions known as the coagulation cascade to form a fibrin clot. The clot acts like a mesh to stop the bleeding. In case of a person with hemophilia, things start to go wrong after the form of platelet plug when the bleed initially even stops. If we are not having enough of one coagulation factor, the coagulation cascade is affected and consequently proper formation of fibrin clots. This leads into wound that is not properly closed, and that's why the bleed doesn't stop.
We treat hemophilia with factor concentrates, but unfortunately the majority of patients with hemophilia, they still don't have access to this kind of treatment, and they are dying every day.
Many times I'm asked about the age when I got my hemophilia. For many patients with hemophilia, this could be a silly question, since everyone knows that hemophilia is a mutation of a gene and you are born with it. You can inherit it from your ancestors, or you can be the first one in your family to get hemophilia, which happens because of mutation. On this picture you can see X and Y chromosome. They contain DNA. We inherit one chromosome from our mother and one from our father. Hemophilia is transmitted with chromosome X. To better explain how you can inherit hemophilia, I'm going to borrow a few pictures from Hemophilia Federation of India. In the first case, a patient with hemophilia has kids with a healthy woman, and the results are healthy sons and daughters who are carriers. In the second case, the mom is a carrier, while the father is healthy. This combination can result in a son with hemophilia, a carrier daughter, or healthy son and daughter. The last case that can happen is when a patient with hemophilia and a carrier falls in love and decides to have a family. Their combination of chromosomes results in a possibility of a healthy son or son with hemophilia. In case of a daughter can be a carrier, or she can be a patient with hemophilia. Yes, girls can have hemophilia as well, and I've already met few. There is one more way of getting hemophilia, and that's why the question about when did I get hemophilia, it's not so silly after all. This type of hemophilia is called acquired and can happen in adulthood when body starts to produce autoantibodies that attack and disable coagulation factor.
When you have a bleeding disorder, for example hemophilia, you tend to bleed into joints, muscles. You can also have bleeds in your brains or in your stomach, but the majority of bleeds are in our joints. A few years ago, I received a video at World Hemophilia Conference in Buenos Aires, where what happens during the bleed was shared. And since the video is very good, I would like to show you so that you get a better idea about what is happening inside your knee when you have a bleed.
Joint function in hemophilia. This is an animated guide which will take you into the knee joint to show you what actually happens during a bleed. We will showcase a healthy knee, review important information and facts on joint bleeds, show you the complications that can arise, and share ways to optimize therapy. Let's start with a brief overview of joint bleeds. Joint bleeds are the most common complication in hemophilia, accounting for up to 85% of bleeding episodes in patients. Bleeds can occur in elbows, ankles and knees, but knees are the most common. They can happen as a result of an injury or can happen without any type of injury. Joint bleeds usually begin by age 2, when the child begins to move around more often. Let's look first into a healthy knee joint. There are 4 main bones to the knee: femur or thigh bone, tibia, also known as your shin, the fibula, and patella or kneecap. The cartilage that surrounds the ends of the bones protects them from the constant friction of movement in that joint. There is a tissue that surrounds the joints called the synovial membrane or synovium. The synovium produces synovial fluid, which works to lubricate the joints and keep them working properly. The clear fluid allows the cartilage between the bones to slide back and forth without any damage to the joint. Normally, there is no blood in the joint space, and the synovial fluid gets replaced frequently to keep the joint healthy and functioning. Maintaining healthy cartilage and synovium is key. Now, let's look at what happens in the knee during an acute bleed. Joint bleeds can occur spontaneously or be caused by an injury. You can see the blood beginning to leak into the joint space. The bleed should be treated quickly, ideally within 2 hours. In case of delayed treatment, the synovium becomes inflamed as blood accumulates in the joint space and the joint begins to swell. As the blood accumulates, the body attempts to break down this blood to remove it from the joint space. The blood is broken down to waste products and iron. This waste and iron that are left behind is toxic to the cartilage, synovium, and bone. If the bleed is not treated quickly or adequately, the bleeding continues and creates an enlarged, painful, and eventually immobile joint. If this were the only bleed, the synovium would be able to reabsorb the blood over time and the joint would heal. However, repeated bleeds into the same joint cause a vicious cycle. And each time a bleed happens, the waste and iron accumulate in the joint, causing further damage and immobility. Some of the iron and waste products are left deposited in the joint space. This damaged joint is then more likely to bleed. Over time, the repeated bleeds cause chronic inflammation that has lasting complications on the joints. The accumulated waste and iron are toxic to the cartilage, bones, and synovium. As a result, the synovium thickens and grows tiny finger-like projections called microvilli. The synovium, with its small finger-like microvilli, are now more prone to getting pinched between the moving bones, resulting in a bleed. This early stage of joint damage where there is inflammation is called synovitis. As a result of this synovitis, the synovium no longer functions correctly. Thus, it is unable to lubricate the joint properly or remove the blood from the joint. Blood also has a toxic effect on the cartilage and prevents it from repairing itself. As this happens, the joint may form bony cysts with a loss of bone mass, leading to further pain and immobility. With repeated uncontrolled bleeds, there is more damage to the synovium and cartilage, until the joint is unable to move. It resembles a crippling type of painful osteoarthritis, and the damage becomes permanent. The damage to joints caused by repeated bleeds gets worse over time, causing pain and reducing range of motion. However, there are simple things that can be done to actively look after the health of joints. By recognizing the early signs associated with a joint bleed, action can be taken to stop it. Pain, warmth in or around joints, swelling and stiffness are all signs to be aware of. Check joints regularly for any changes in how they move or feel. If you feel something, do something. When a bleed is detected, it is important to treat with factors as soon as possible. Early treatment means less blood in joints and fewer complications, over both the short and long term. Besides treatment with factors, other options to treat a joint bleed can include protecting the injured joint from undue stress, resting the joint for at least 24 hours, applying ice for 15 to 20 minutes every 2 hours, compressing the joint using a bandage or compression stocking for the first 24 hours, elevating the joint. Treating bleeds early is very important. However, there are simple things that can be done to actively look after the health of joints and so limit the impact of joint damage. Lifestyle choices, such as keeping fit, maintaining a healthy weight, and being more aware of what activities help or harm joints, are all part of protecting joints from damage. Doctors, haemophilia specialist nurses, and physiotherapists have lots of different ways to help people with haemophilia keep their joints healthy for longer. This concludes the Joint Function in Haemophilia presentation. If you have any other questions, please talk to your doctor or haemophilia team. Thank you for joining us.
As you have seen in the video, having a lot of bleeds in our joint is not good at all, as you probably know by yourself. So what can we do to prevent these bleeds? If we are talking about bleed that is based on injury, you just have to take care of yourself. You have to be more cautious while doing activities during the day. However, there is a bleed that is called a spontaneous bleed. The name refers that we can't really control this kind of bleed. However, I discovered that it's possible, and this is going to be the topic of the new video, when we're going to discuss about what is a spontaneous bleed and how we can gain control over it. Thank you very much and see you soon. Bye bye.